So in the case of this particular article, and again, this is an article from BMC Rheumatology in 2025. This review specifically looked at HIIT exercises in adults with inflammatory arthritis, including people that have rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. How do they do this? They searched the medical database for randomized controlled trials where high-intensity interval training was the main intervention. They compared HIIT exercises to moderate intensity training or usual care.